and it was saying your bio is saying about yourself that you helped get implemented the non-STEMI in sepsis protocol.
Yeah.
French.
Yeah, we wanted to be the STEMI receiving center.
How does that work?
And so you actually apply with the state, and the state reviewers come, and you have to have protocols on how you're going to work with the response system. And so you have to be part of EMS and how you're going to work with the other hospitals. So we had to have the other hospitals on board with how we were going to work together. We met it with the ER doctors, the cardiologists, and the EMS system multiple times to kind of create a path that was better for the community, because then they didn't stop. Each time I did something that took extra time from my regular job, it always had a patient. So that patient, her name was and had been triaged at another facility, and unfortunately she stayed there so long, and it took so long for her to get the proper care that she actually turned into what we call a cardiac cripple, and she never survived much of a life after that. So we were like, we got to change this. And it wasn't the other hospital's fault, it was just the way the system was. They stop and they pause and they triage, and then they do workup on people. So it was kind of exciting to see like how could we integrate it, because it was a couple of years prior to the state guidelines coming out. So we didn't have the recipe that the state was going to make us do. But by the time we were done, the state guidelines came out like 6 months later.
Done with your project?
And had been passed and acknowledged as the receiving center. So that makes it so that the emergency response system doesn't have to stop at other hospitals when they for sure have somebody that has a STEMI going on. So if they think they're going to have a heart attack that's going to kind of cripple them for life, they can just pass the other facilities, saving lots of time.
So you're saying the patient you guys had that made you kind of implement all of this and wants to get like a protocol or like a plan to follow, you said too much time had kind of passed by.
Yes.
In terms of their heart tissue being deprived of oxygen, and then it's just like
way too
necrotizing.
Long. Yep. By the time we got her, she didn't have any motion or movement back, even though we did open up the vessels. It had just been too long. So that was it was very sad. And it wasn't just me. It was like very led by one of our leading cardiologists at the time. And him and I actually also later had a bad incident with a person having a femoral access. And that made us be prompted to try and become the first to treat STEMIs with a radial access. Prior to it being something that we were told by other, I think CMS now actually says to do that. But at the time, it was something we chose to do based off of another patient who had a very bad outcome from that. So, yeah, he was actually a very... He had his opinions, but he was a very strong leader, and he actually could keep us together as a group, and that kind of helped make it work, And he knew when somebody had too much.
Yeah.
So I always appreciated that. I saw him at a restaurant recently.
Oh, nice.
It was really nice, And he was like, "Oh, wow, you're looking great," and I'm like, "Yeah, you do." So it's kind of, we both parted other ways, but it's nice to see that things we worked really hard on probably made a difference. Yeah.
So when someone's having a heart attack, where was all the time going when, when you're saying, hey, too much time had passed, too much heart tissue had died, we need a system, a plan to follow when someone is having a heart attack? Like, can you give an example? ambulance going to the wrong hospital, or are they waiting in the emergency too long? Like, where's all the time going?
Well, sometimes it's the family drives them to the hospital, and then when they get there, getting in the door and getting through the triage process, and some people don't articulate things well, and she was female. She might not have called it chest pain. So in all of that, at the other facility, you know, we never caused blame, but it surely was over an hour and a half. It was hours before she decided that she was having a heart attack, and then they called us. Then there's another ambulance that has to come pick that person up and then transfer them one more time. So, you know, in and all of that, you're 2 hours plus. That could have been avoided if the patient, you know, had been brought to the correct facility in the first place. But sometimes it's always hard to do the right thing, because I'm not sure if her husband drove her to that facility. Yeah, but long story short, we remembered that patient for a very long time.
Why can't you get treatment at a different hospital?
They don't have cath labs.
Oh, and you need a cath lab
to do the
PCI, percutaneous intervention.
Yes.
Okay.
So you need a cath lab to fix the problem.
Okay.
You can give them drugs, but that's not the gold standard.
Mm-hmm.
They're not going to have the same outcome. So.
And you're a cath lab nurse.
Yeah.
You were for most of your career?
For quite a few years. I went into that kind of on default.
Yeah.
That was a different story. But
were you ever like med surge, like on the floor?
I worked on med surge, DOU. I actually loved med surge DOU because there you could do a lot of patient teaching. I really appreciated that. I always am gung ho for people to start there.
Yeah.
Yeah.
Yeah. No. Yeah.
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 Because it helps you put it all together and recognize what a patient that has the symptomology really does look like.
Mm-hmm.
Yeah. And especially when they don't tell you.
Yeah.
And you're kind of trying to piece it together.
Yeah.
That you become a better detective. Yeah. So that's a good thing.
When someone's having a heart attack, like the treatment is doing the percutaneous intervention in the cath lab.
Yes, as quick as possible. Less than 90 minutes.
And that's crazy that... Am I allowed to say hospital names or no?
I don't know. That's why
okay, I'll take out all the hospital names.
Yeah.
I'll just bleep it out.
Okay.
I can't... doesn't have a cath lab.
It does. It has a beautiful cath lab.
Yeah. So
we all
if you're
worked
having
there
a heart
for
attack,
5 years. They aren't allowed. So as a STEMI receiving center, we're the center to hold the equipment for everything. So they're allowed to have emergency equipment, which is a very, very, very bare bones. It would be like saying in your cupboard you have a salt, pepper, 1 can of beans, and a loaf of bread.
Okay.
Versus like a full stocked shelf, right? And everybody has a different size vessel and so they have pretty much nothing if, because that's just the guidelines that the state makes with it. So all of the equipment's over at the other, and it would be kind of criminal to treat them there. But they do have, except for now, things modernized